Hello, and welcome to the Care Coordination Minute. This is episode 3. And as promised in the last episode, we're going to talk a little bit about clinical staff. That tends to be an area where I get a lot of questions. So I just wanted to clarify that for some people. Who can be that clinical staff? So, as we're looking at this, when we talk a little bit about all of these elements that I went over in episode 2, keep in mind we need to be sure that the person who is working as overall in care coordination or care management, whichever title you give them, they need to be able to perform all of these functions within the scope of their practice. That's the most important thing. Now, when we talk about clinical staff, it doesn't have to be just one person. We can have a combination of people in a team based approach that are indeed taking care of all of these elements. Typically, it's easy to say an RN because a registered nurse absolutely has the training, education, and the scope of practice in their license to be able to do all of these elements. But we want to make sure that as your program grows, you can certainly bring in other people who can do parts of these elements. So I often get the question, can a medical assistant be the care coordinator? And the answer to that typically is no, not independently. They cannot. Why is that? Because it is not within their scope of practice. They have a 100% delegated scope as a medical assistant, and it is not within their scope of practice to do assessments and gather all of the data and then make clinical decisions based on that. And one of the big clinical decisions would be in that care planning. So, what's the appropriate care planning? So, sometimes we have an RN who's overseeing a program. Maybe they have another job and they're not the main person who's interacting with the patient, but they do interact with the patient. They do make sure that care plan happens. And then they can delegate things to the MA through the provider, or the provider can delegate things to the MA, and the MA can making sure that they are keeping track with their medications, making sure that they are referring them to the appropriate community resources, all of the things that are out there. Keeping in mind that, remember, a patient has two or more chronic conditions. So, who's ever you're using in that clinical staff, they need to understand the chronic conditions. They need to be able to understand the medications that go along with those chronic conditions. Those are a biggie. They need to understand if the patient says, well, what happens if I don't manage this? And like, what's going to happen? They need to be able to answer those questions. So those are some of the areas. I often also get asked about an LPN or LVN, depending on what state you're in. And the same answer, an LPN or an LVN may indeed do assessments. They usually understand medications and the diseases that go along with that pretty well. But what they cannot do is they cannot make a care plan, a plan of care based on an abnormal assessment. They may assess normal versus abnormal, but when something comes out, it's not within their scope of practice to make clinical decisions independently based on an abnormal assessment. So that's why they also need an RM. Now, can providers do a care plan? Absolutely. Absolutely, providers can do a care plan. So if you are absolutely sure you want to use an LPN or an MA, your care planning must be done by the provider. Maybe that's a nurse practitioner, maybe it's a PA, maybe it's a physician. But one of the points of doing CCM is to offload the physician and offload those providers. So if you are trying to run your program with somebody who isn't qualified to do all of the elements, and you have to keep going back and providing more work for the provider, we have not found that to be a very successful program. So I just want to make sure that's clear. Now, not just RNs have these abilities. We have programs where there's registered respiratory therapists, for example. They absolutely have scope of practice that can do assessments, that can create care plans. We also have pharmacists, pretty expensive, but we also have pharmacists who are acting as care coordinators. Absolutely. Clinical pharmacists can do assessments, can do all of these pieces, can make clinical decisions. There are other types of professionals like physical therapists. You could also use occupational therapists. It's all going to depend on your type of patient population if those people would be appropriate. Also, registered dietitians make pretty good care coordinators. A lot of things has to do with diet and exercise, and they're well versed in all of the disease processes and medications that go along with that. So there's lots of different people, but you don't need to make sure it's within their scope of practice, that they can do all of the elements, or at least be the person overseeing that all of these elements are made. Because what it really comes down to is this is patient-centered care. And this is the definition of patient-centered care. And we need to make sure we understand, and so we can be respectful of and responsive to what the individual patient's preferences are, what their needs are, what they value, and how we can work with them so that all clinical decisions are based on what the patient values. So you need to have people in this clinical role who can make those changes, those nuanced changes that can fit this. So having specific, you will do all these things and then all these things and all these things, and those guidelines are great, but not all patients follow guidelines perfectly. How can you adapt those guidelines? So you must have the clinical knowledge to be able to make those guidelines adaptable, and it must be in your scope of practice to do that. So I know it's not a black and white answer. Everyone always wants a black and white answer, but that's what they mean by clinical staff. The people who are actually able to do it by education, training, and scope of practice. So hopefully that gives you a little bit more clarity. And that is the end of episode 3. So thank you so much. And again, for more questions or to go back and watch previous episodes, don't forget to follow us on Facebook or on LinkedIn. These are our two pages. Thank you. Have a great day.